starting salads, transitioning from formula or breast milk. They have changed recommendations from 4 months to 6 months now. The baby should only have formula or breast milk up until 6 months. Some pediatricians will give the go-ahead earlier, like at that 4-month mark still, if the baby is showing signs of being ready, such as sitting up on their own, showing interest in the food, that kind of stuff. But they have changed their recommendations to start salads at 6 months now. So like I said, when the baby is showing these signs is usually when they give the go-ahead to start adding in those infant salads. So when the baby can sit up alone or with minimal support, can control head and neck. When the baby opens the mouth, when food is offered, when the baby is able to swallow food rather than push it back out at you or on the chin. This one's kind of hard because every baby brings objects to their mouth. That's how they learn. But when they are showing interest in bringing more objects to the mouth, when they try to grasp small objects such as toys or food, and when they transfer food from the mouth to the back of the tongue to swallow. So when you have the go-ahead from the pediatrician or the baby is showing all those signs and you're interested in starting salads, you will start with offering breast milk or formula before offering the solid foods. The breast milk or formula should be the main component of the infant's diet, and the foods are just added in to offer additional nutritional support. You're going to start with small amounts of food. And then when you are starting new foods, it's normal for the baby to kind of gag or cough or make a funny face when trying the new foods due to texture mostly. It's not anything to be worried about, but be on the lookout for any choking, which the child may look like wide-eyed, they may look scared. If they are really choking, there won't be any sound coming out because their airway is blocked. The baby may turn colors, such as like a blue tint around, you'll notice it around the mouth first, the nose, the fingers, and they won't be able to cry, breathe, or make any noises. A baby who is experiencing just a gag reflex in regards to texture will be coughing and making sound still. So it's okay to continue after they stop. So in addition to the salad foods, you can start out with infant cereals. Those are usually the first go-to for parents that want to start salads. It's a good first option because it's mild, it's easy for their stomach to digest, and there is iron fortified options, which is good for the baby's diet. Cereal is not meant to be added to the bottles. That is a choking risk. It's something that doctors used to recommend all the time to parents, and now they have kind of changed their ideas about that. But you'll start by adding breast milk or formula to the cereal, and you can make it as thick or as thin as you want for the first time. Usually when you're first starting, the thinner the better for the first few times, and then the thicker as you go on. And cereals, they are not a requirement. It's just an extra additive for the baby. In addition to BabyLed weaning, there's also the option of purees, or you can do a combination of both. So I figured I would touch base on purees too. So purees are a blended or pureed food that is spoon-fed to the baby, or the baby tries to feed themselves. The texture should gradually increase as they age, getting ready for table food. So you can start out with something that's super simple, like bananas or like apples, blueberries, that kind of stuff, and kind of work your way up to those more textured items. Green beans are a good start, peas. You can make your own purees at home with a blender, food processor, if you feel more comfortable that way. Then there's also store-bought options. And then if you aren't interested in the purees, then there's BabyLed weaning also. There's a lot of research that shows that BabyLed weaning helps with improved motor function because they are picking up their own food and feeding themselves, whereas the purees, you're feeding them and they're not really getting as engaged with the BabyLed weaning. They can kind of stop when they want to. The purees, it's kind of just like feeding them over and over, and they don't really have a way to tell you that they're done with that. So the BabyLed weaning leads to a little bit more of independence, and they say it's better in the long run with the BabyLed weaning, but either option is fine. I do purees with my baby. She's 10 months old, and I'm just now starting to give her actual real pieces of food. Whatever every parent is comfortable with is what's good to start. So BabyLed weaning is introduction to foods based on baby size bites. So it's basically taking whatever you're eating and giving to them. You don't have to do any extra processing like the purees. So this little guy has some, looks like carrots, maybe some celery or something. But you just, whatever you're working on eating, you chop up into little baby sites baby sites bites for them and give to them. It makes it more convenient for parents that are busy because they don't have to buy the purees, make the purees, that kind of stuff. Baby can explore what's on the plate. They're able to experience taste, smell, and texture all on their own, whereas the purees, like I said, they are kind of more not forced, but it's not on their own basis of exploring the food. The babies gain fine motor skills, ability to regulate being full, and gain positive food habits by being able to explore and feed themselves. So when you are introducing new foods, it's recommended that you try one food at a time and wait 3 to 5 days before trying a new food item. This allows for time to show for any allergic reactions. And the main allergy categories would be like eggs, dairy, stuff like that at the very beginning. So when introduced or talking about food allergies, it's recommended that you give your baby potentially allergic foods when you introduce complementary foods. So they want you to give those foods that could possibly cause an allergic reaction during the process of starting the regular foods like peas and stuff like that also. They don't want you to wait, because the longer you wait, the more of a risk that an allergic reaction can occur. So the potential allergenic foods is peanuts and tree nuts. So peanut butter, almond butter, that kind of stuff. Eggs, cow milk products, any dairy, wheat, shellfish, fish, and soy. So they want you to, they don't want you to hold back. They want you to give all of these foods to the baby just like you would bananas or peas or green beans or whatever else that you want to introduce to them. Some foods that you would want to avoid include honey before the age of 1 because it can cause botulism. Straight cow's milk by itself before 1 because breast milk or formula should be the primary beverage until your baby is 1 year old. It's fine to use cow's milk in cooking or baking. And then choking hazards during the first year, including any nuts, seeds, raisins, hard candy, grapes, popcorn, peanut butter, and hot dogs. If you do give any hot dogs or grapes, you'd want to cut them in very small pieces, not circular, that can block the airway because that can cause a risk for choking. Some changes that happen when you start to introduce solids. The first one that you'll probably notice is changes to stooling patterns. Most of the time it will change in color, texture, and odor. And as babies start to experiment with more food options, they may seem more interested in food than in bottles or nursing if you're nursing. And another thing you can expect is a messy, fun time. It's always fun to see what their favorites are and their faces when they try new things.